Sevoflurane and Isoflurane are both widely used in inhalation anesthetic gases with different characteristics and clinical uses. Onset and recovery. The Sevoflurane known for a rapid onset and recovery due to its low blood gas partial coefficient. This means it moves quickly in and out of the blood, making induction and emergency faster, which is especially beneficial for shorter surgeries and pediatric cases. On the other hand, isoflurane has a slower onset and recovery than sevoflurane with a higher blood gas partial coefficient. While it's not as fast as sevoflurane, it provides a stable, long-lasting anesthetic depth, making it more suitable for longer procedures. MAC value, or the minimum alveolar concentration. In sevoflurane, it's about 2%, meaning it's slightly less potent than isoflurane, and a higher concentration is needed to achieve anesthesia. Isoflurane has MAC of around 1.15%, so it's more potent. This can be beneficial for patients where lower anesthetic doses are preferred. If we take the difference between airway irritation, in sevoflurane it has the minimum airway irritation, which makes it well suited for inhalation induction, especially in children. In isoflurane, it can cause airway irritation, coughing, and salivation, which make it less ideal for induction and often used after IV induction. If we take cardiovascular stability into consideration, sevoflurane maintains a cardiovascular stability but can cause slightly hypotension due to vasodilation. It is less likely to cause tachycardia compared to isoflurane, whereas in isoflurane known for maintaining good cardiac output, but it can increase heart rate slightly. It's considered to have strong cardiovascular stability and is often preferred for patients with cardiovascular conditions. Metabolism and toxicity. In sevoflurane has a small percent of metabolized by the liver and the procedure some fluoride ions which can be nephrotoxic in higher concentration. However, it's generally considered safe with proper ventilation. In isoflurane, metabolized at a much lower rate, so it's likely less to produce toxic metabolites. However, it can interact with soda lime in the anesthetic circuits, produce a carbon monoxide if used in certain closed systems. In terms of cost, sevoflurane is expensive than isoflurane. Application in pediatric and outpatient surgery. The sevoflurane often is used in pediatric and outpatient settings because its smooth induction and fast recovery and lower likelihood of post-operative agitation. Isoflurane less commonly used in pediatric due to its risk of airway irritation and slower recovery, but still a valuable choice in certain settings due to its cost effectiveness and cardiovascular stability. This was the basic difference between Sevo and isoflurane.